Mkhize is on a 2-day visit to the province. The minister will be checking how health facilities in the province are coping with regards to the influx of COVID-19 patients. Dr. Mkhize will attend the official handover of the Richmond Hospital site, the Richmond Hospital COVID-19 site. It's where we find my colleague Vusi Khumalo, who is covering this story for us. Vusi, very good morning to you. What can we expect today?
Good morning, Plain, as well as to the viewers. Yes, we are here at Richmond. This is KwaZulu-Natal Midlands, whereby we are expecting Minister Zweli Mkhize, the Health Minister, to have an oversight visit here at this hospital, as we know that they will be handing over the new facility just behind me in my background. This is a 50 plus bed facility whereby the COVID-19 patients will be transferred here and perhaps get some treatment here at this facility. Well, Zweli Mkhize will be here just to also monitor the developments, as we know that KwaZulu-Natal, as the rest of the country, are expecting a peak in a few weeks to come. And also KwaZulu-Natal, we are beginning to see a trend of an increase or a peak, especially in rural districts such as Umgungundlovu, where we are now, because the majority of this area is made up of the rural areas, as well as other districts such as Amajuba and Uthukela, whereby the positive cases are hovering around 4,000 and also from 3,800 to 4,500. But Umgungundlovu district is one with the second highest number of positive cases at 12,000. Number one in the province is the eThekwini municipality with 41 positive cases. But what is also maybe a plus is that in the province of KwaZulu-Natal, as we have more than 87,000 positive cases, about 53,000 of those are people who have recovered, of which that is 60% of the recovery rate of positive cases in KwaZulu-Natal. And also what is also pleasing for other districts here in the province of KwaZulu-Natal is that Ilembe, of which has been always number 2 following eThekwini, is now number 5, showing that it is also maybe stabilizing. The situation there is not that bad, but we are expecting a peak in 2 weeks to come, as Zweli Mkhize did say that he's also visiting this area to also ensure that he's got meetings with management district and also the hospital management, just to also monitor the developments and also better understand the challenges that these facilities are having, and also offer some solutions where he could. Well, the works are still taking place here. We can also see that Zweli Mkhize, we are told that he'll be here in few minutes from any time from now to monitor and also to conduct his oversight visit at this facility, which is newly built, and also it's just been, we are told it's just been renovated in order to house COVID-19 patients. Plain.
All right, so numbers coming out from KwaZulu-Natal, 87,796. This is the cumulative cases. So far, with regards to recoveries, 51,857. But over 1,000 people have lost their lives. We're expecting the peak to hit soon. Having said that, Vusi, what's your sense on the ground with regards to people? Remember, this fight is not only a fight on the front lines with regards to nurses and doctors. This is a fight for individuals. It's a fight for families. What's your sense on the ground? Are people adhering to the health and safety protocols as laid out by the WHO and other bodies in order to curb the spread of COVID-19?
Well, the situation on the ground, Plain, is that since like most industries have opened up, and also we are seeing quite a number of people going to work, and also the taxis taking 100% of the load. And also we're seeing quite a number of people in various places such as the towns, as well as in the townships and rural areas. What you have observed over the past few weeks is that we have also visited KwaMashu, whereby about 50% of people that we have seen, most of them are not wearing their masks on, and also some are not even adhering to social distancing protocols or health protocols that are being followed. But plainly, I must say that some people do follow, especially people who are working, and also some of the big supermarkets, whereby they are saying no mask, no entry in many places or facilities here in the province of KwaZulu-Natal, because they are ensuring that everyone who enters a building does wash his or her hand, and also is also wearing a mask to ensure that, and also adhering to some of the social distancing protocol here in the province. And also, Ben, I must say that the funerals here are quite a bit concerned, because they are being attended by a number of people who are more than 50, of which that's a required number of people who should be attending the funeral. That's one of the concerns taking place. And also we've had Nehau and also Dinosa saying that some of the health facilities in the province, I mean the nurses and also the doctors, are always complaining about the quality of PPEs, and also that once a doctor or a nurse or health practitioner has been tested positive, some of those facilities are not being decontaminated and also being sanitized. So those are some of the concerns here on the ground in the province of KwaZulu-Natal.
All right, Vusi Khumalo, thank you very much indeed for your reporting, monitoring the situation there in KwaZulu-Natal. When the minister arrives, we'll touch base with Vusi again. Vusi Khumalo, live for us in KwaZulu-Natal.